CQL's personal outcome measures, people exercise rights. Assist me to have a voice. Listen to what I say. When I tell you what I want, respond in a way that tells me I'm a person first and foremost, and respect me by acting on what I say. When we talk about people exercising rights is the most influential outcome of all the outcomes. If people didn't have the opportunity to exercise their rights, think of all the outcomes they would never achieve. They would never choose goals or choose services, vote, choose a religion, socially interact, or even make friends. The title of my project is Honoring Individual Rights, and we realize that people's rights should always be promoted and protected. The focus of my project is Basic Assurances Factor 1 indicators E, F, and G, and you are probably familiar with these. Indicator E, staff are trained to recognize and honor people's rights. Indicator F, the organization upholds due process requirements. Indicator G, the organization has access to a working and effective human rights committee. Why was the project selected? This project was selected based on data collection and analysis of 69 statewide certification reports dating from October 1st, 2012, and I know y'all are all familiar with that date, through November 11th, 2013. Well, here's the baseline data results of that analysis. You see the red line going across. The average score in agencies meeting the indicators in Factor 1, the average score is 70. And we see indicators A, B, C, D, and E, A, B, C, and D, very good scores actually, above 70. And then we look at indicator E, F, and G. And you see that we have below average percentages of agencies, of 69 agencies meeting these indicators. So we realize that we need improvement in these areas. And you see the good arrow, the black arrow pointing up. That black arrow means continuous improvement. And throughout the presentation, we're going to be talking about indicators E, F, and G, and how we can improve in these indicators, because we're always going for effective results. So we want to look at some ways that we'll be able to do that. So root cause analysis. We'll look at some of the reasons why these indicators are so low. We'll look at We'll look at action steps to determine what can be done to increase these scores and these indicators. What action steps did we take? And possible solutions. What solutions did we develop to improve these indicators? We'll look at those, and implementation of those solutions with time frames, when these solutions were put in place. And we'll be tracking and evaluating the progress of these solutions, tracking to see what progress is made, and evaluating, always measuring solutions that we put in place. I wanted to back up a little bit and think, well, how are individual rights being assessed? Let's start at the beginning. So what I did was I conducted a sampling of 6 agencies statewide, and it's 6 agencies out of the 69 originally. of those 69 certification reports. I figure with the method of a sampling, the improvements that we can make with this sampling may benefit everybody. These agencies in the sampling had a survey score of 92 to 100%. These are our higher scoring agencies. So I thought, well, how are they assessing individual rights? And could that assessment be shared with the rest of the agencies in the state who didn't score as high? The service areas in the sampling include residential, personal care, comprehensive, and case management. What action did I take? Well, I collected all the rights assessment from the sample agencies. Of course, there were 6. And I formed a committee of self-advocates receiving supports. Made a mistake there. Advocates who receive supports. And I realized from the committee that they don't like to be called self-advocates. We've used that term so much that it has become a label. So I'll refer to them as advocates receiving supports. We participated in weekly meetings beginning May 2014, and we conducted a comparison of the rights assessments in the sample. We chose and developed a rights assessment for our DMH website. And you may have gotten an email about that assessment, and hopefully you've downloaded it and maybe already used it. But I'm going to give you a sneak peek of that in a minute. Here's a comparison of the rights assessment results from the committee. What doesn't work with the rights assessment? Wording that's hard to understand. Small print, because it makes it difficult to read some of these assessments. Some of them are too long. The term don't understand. They'd rather see a term that says maybe need more education. Not about the person, not person-centered. But what works? Well, pictures. I thought pictures work very well, especially with someone who doesn't use words to communicate. Wording that's easy to understand. And short. We get tired of answering questions. So you think of all the assessments that they have to complete. They want something short, to the point. Talking about supports. They like talking about supports that could be put in place to assist them in exercising their rights. And something, of course, assessment that's more person-centered. Our mission was accomplished, and by September we did have a rights assessment that was uploaded on the website. What are the benefits of this new assessment that we have? Well, individuals supported and providers have access to a person-driven rights assessment, and this is one goal of the committee. It's very easy to complete, a good source of data for the planning process. Training for staff members in understanding people's preferences and identifying goals. And we start talking about Indicator E, we'll talk more about individual preferences and staff assisting individuals in identifying goals for their rights. So what makes it an assessment? Well, it answers 2 critical questions. What rights are important to me? And what supports do I need to exercise my rights the way I choose? Exercising the rights, how and how often I choose. And only providing the supports needed or requested in exercising those rights. And we'll talk more about that as we move on with the presentation. The website address, www.mh.alabama.gov, the link to download this rights assessment, community programs, and it will be under person-centered planning, format, and instructions. I want you to download this assessment, look at it, review it, use it, compare it to what you're currently using now, and most importantly, the people you support. Let them compare this assessment that's now on the website with what you're currently using. Here's a sneak peek, simply titled, "Hey, don't be getting my rights all wrong." and very simple instructions for completing. Please choose the answer that best describes your situation. And we'll get to the scoring in a minute. Look at money. The committee thought money was the most important thing, their right to access their money. Well, an individual might answer A. Well, what money? I'm out of the loop. I have to ask when I want and need money. I rarely, if ever, go to the bank. Someone else keeps my money for me, other than some spare change I might carry around with me every now and then. Or, yay, I have control over my money. I do my banking and have a checking or savings account in my name. I keep my money in checkbook or debit card. I am primarily responsible to decide how I want to budget and spend my money. Regarding relationships, well, look at A. I need more information about having a good relationship with my boyfriend or girlfriend, including having safe sex or learning more about getting married, being involved in a serious relationship. Or C. They may answer C. I have excellent support in all my relationships. But when it comes to voting, look at A. I want more information on voting, elections, on the issues that affect me. Or C. I'm a registered voter. Vote in any election I choose and support the candidates or issues I believe in. Or they might answer D. People may have thought I wouldn't be interested in voting, so I haven't had an opportunity to learn about this yet. We added this item, thought it was very important. My freedom from abuse, neglect, mistreatment, and exploitation. Look at A. I am uncomfortable with some things that need somebody to talk to. For example, people yell at me or hit me. There's never enough food in my home. People often use my personal items without my permission. People listen to my conversations when I'm on the phone or have visitors. Well, they might answer C. I'm not experiencing any abuse, neglect, exploitation, or mistreatment in my life. And I do have someone to assist me if I need it. That go-to person. That go-to person is very important. So, with the answers A, B, C, and D, there is a point system. For A, you get 0. B, you get 1 point. C, you get 2 points. And D, you get 0. And you total all the points up in the end after you've answered each item. And you have a point spread, a scoring point spread. 0 to 5 points. Yikes, my rights are being trampled on. I need support. Or 6 to 10 points. I still don't have enough support to get my rights right. Or 16 to 22 points. For the most part, I'm exercising the rights that are important to me in the way I choose to exercise them, and I have great support to do so. And of course, you're answering the 2 critical questions in the assessment. What rights are important to me, and what supports do I need to exercise my rights the way I choose? When we talk about using data in multiple ways, this assessment is an excellent tool. When you have this point spread, let's look at 0 to 5 points or 6 to 10 points. If you have a point spread that is low in those areas, 0 to 5, 6 to 10, you realize that your agency needs to make some improvements on how individuals supported or exercising their rights. It's also a good way for staff members to be able to learn people's preferences in regards to their rights, and also in helping them identifying goals and exercising those rights. And we'll get to that a little later in the presentation. I'm going to give you some examples of that. But excellent data on where that person is and exercising their rights, good data to take to the planning process. And I really think that it kind of takes some of the guesswork out of it. But an excellent tool, and not only do I want you to download it, I'm encouraging you to use it and see if it works for the people that you support. Okay, factor 1. Let's get into indicator E. the root cause. Staff are trained to recognize and honor people's rights. I continue the sampling of the 6 agencies of the 69, once again, who had a survey score between 92 and 100%, and to know how they were training their staff in Indicator E. Maybe this could be a resource for agencies who didn't score as high. So I conducted a drill down of the training curriculums in the sample, and I answered those curriculums against probes 1, 2A, and B, 3, and 4 in Indicator E. Probe 1. Are all staff trained to recognize and demonstrate respect for people's rights, including how people choose to exercise their rights? Probe 2. Are staff that complete rights assessments trained to A, understand and support people's preferences in regards to rights, B, identify goals related to exercising their rights, and to support attainment of those goals? Probe 3. Are staff trained in due process procedures? Probe 4. Are staff trained in any procedure for placing a limitation or restriction on a person's rights? This is the results of that drill down based on the data collected. What I found out is those 6 agencies in the sample, 33% of the agencies included training in Factor 1E. 67% of the agencies in the sample did not include these items in their training. So 2 out of the 6 agencies actually had training in Indicator E in their training curriculum in these areas: due process, identifying goals, rights assessment, and honoring rights. Let's look at Indicator F, Factor 1, Indicator F. The organization upholds due process requirements. I looked at Probe 4, once again, the sample of 6. When any restriction, or rather a correction on that, there was a sample of 5 agencies, and I didn't include case management because they don't necessarily track rights restrictions. When any restriction is being proposed for a person, the person is reported to attend and provide input at their HRC meeting, and conducted a poll with 5 agencies in the sample who had a survey score, once again, of 92 to 100% or higher scoring agencies. I wanted to determine the number of individuals who had rights restrictions between 10/1/2012 and 11/11/2013. Once again, the time frame of the data from the 69 surveys. And of those, how many of these individuals were supported to attend their HRC meeting, and what supports were provided? Well, what I found out is they got an invitation to the meeting, their plan of removal was explained to them, and they received transportation to the meeting. Well, how many attended their HRC meeting? These are the results of Indicator F, Probe 4. What I found out is 61 people had rights restrictions. 61 people were supported to attend the meeting, meaning they were provided transportation. The plan of removal was explained to them, and 15 people actually out of that 61 attended the meeting. And I found out these 61 rights restrictions were primarily representative payee, but only 15 people out of that 61 attended their HRC meeting. I looked at Factor 1, Indicator F. I also looked at Probe 5. Are people provided adequate training in due process procedures, including A, any procedure for placing a limitation or restriction on a person's rights, or B, training that supports the removal of the rights restriction? Indicator F, Probe 5A and B. The results, once again, the sampling of 6 agencies included in this with a survey score between 92 and 100%. I conducted a drill down of this training curriculum in Indicator F, Pro 5, A, and B. And this is the results. 33% of the agencies in the sample provided adequate training and due process for people supported. 67% did not. What action did I take? I got the information. I realized only 33% of the agencies included training in indicators E and F. So this is what I did. The Quality Enhancement Specialist, that would be me, teamed with Zena May. She is a state advocate. We began meeting bi-monthly beginning June 2014. And we analyzed the training data. We looked at these curriculums and thought, well, what do we have in these training curriculums and what's needed? So we researched other resources as well, and we developed an individual rights training PowerPoint for the DMH website entitled Honoring Individual Rights for individuals who receive supports, providers, and also family members. And here's the website address, the link, community programs, and it is also under person-centered planning, formatted instructions. An excellent PowerPoint. It's very comprehensive. I feel confident to say that it includes most of Basic Assurances Factor 1, excellent tool for new staff members, and also as a refresher training for staff. The only indicator it does not include is Indicator G, and there's a separate PowerPoint for Indicator G, and we'll get to that in a minute. So these are some of the resources that we use to develop a PowerPoint. We utilize staff training materials collected from the sample agencies, of course. Personal outcome measures, always an excellent tool. Alabama DD Administrative Code, our standards. The Incident Prevention and Management Manual. Basic Assurances Self-Assessment Tool, Factor 1, including information from Basic Assurances. And a wonderful PowerPoint from CQL, Supported Decision Making, whose goal is to provide only supports necessary in people making decisions. A wonderful PowerPoint with a lot of good information, so we were able to take some good points from that. Now here's a sneak peek of the PowerPoint, Honoring Individual Rights. Hoping that you will download it and use it. If you do not have someone in your agency who provides training for your staff, the state advocates can use this PowerPoint to come and do training for you. Let's start with exercising and prioritizing rights. People prioritize and exercise rights that are important to them. People choose how and how often they exercise their rights. Here's where the support staff comes in. Support staff recognize and respect individuals' preferences for exercising their rights, including how people choose to exercise their rights. Support staff provide assistance for individuals to identify goals related to exercising their rights and provide the supports in the attainment of those goals, and only the supports needed to attain those goals or requested by the individual. We're going to get to some examples in a minute. The individual outcomes and supports in regards to exercising their rights are part of their person-centered plan. The progress made is tracked with target and completion dates. And, of course, tracking progress is very important because you want to know if the supports that you put in place are actually working. So you can work towards, the completion or the accomplishment of that outcome. There's some examples of prioritizing rights. Being a registered voter is something I value and is very important to me. I want to vote in all elections, not just national elections. I would also like to be involved in a campaign of a candidate I support. Example, my faith is important to me. I enjoy attending St. John's Catholic Church, but I only want to attend every other Sunday. I do like to spend some Sunday mornings just drinking coffee and reading the paper. Good examples of how and how often people choose to exercise their rights. We included a very simple definition of what is a rights restriction. My simple definition is if it's a rights restriction for me, it's a rights restriction for them. But here's a very simple definition. Restriction means anything that limits or prevents a person from freely exercising his or her rights. Something is usually considered restrictive if it impedes the enjoyment of general liberties that are available to all citizens. Here's some examples of rights restrictions. Locked areas, restricted diet, represented payee, schedules, smoke schedules, snack schedules, activity schedules, not allowed to date, bedtimes, or wait times, not having enough privacy, not able to choose my activities for entertainment. You know, I may not want to go to the rodeo on Saturday night. I may want to go to a bar and get a beer and listen to some music, or maybe a movie. Choosing what I want to do for entertainment. Taking medications to manage my behavior. Asking permission for things like bath tissue and paper towels. Or telling staff before I do things. Example, I'm going outside. I'm going to take a shower. Having to tell staff before I do things is a rights restriction. We also included some training on due process. It's important that people are treated fairly, and if they haven't, those issues need to be identified. An individual's rights cannot be restricted without due process. Due process is a fair process with the opportunity for the person or legal representative to present objections to that restriction. And, of course, a review by a Human Rights Committee. What is the process? 14 meets with the individual and or legal representative and provides a valid reason for the restriction in a language that is understood. The individual and or legal representative can provide input regarding any objections to the restriction. Will develop a plan of removal of the restriction with a training component. The plan is explained with the person and a legal representative, including the benefits of the strategies, which may include training. So it may not be a formal training goal. It could be just strategies to lessen that restriction. The individual is supported to attend the HRC meeting. We're going to get into how you can support that individual to attend that meeting in a minute. It also includes, of course, an invitation to attend. The individual does not have to attend the meeting and may send a representative. However, it is important to provide additional supports to prepare the individual for the meeting should they choose to attend. The HRC, in some cases the BPRC, reviews the restriction and the plan of removal and then makes a determination if the restriction is in the best interest of the person. The progress of the strategy and our training is tracked with target and completion dates, and we want to make sure that we're tracking the progress because we want to know if the strategies that we have in place, are they working? Do we need to revise our plan? We want that restriction to be minimized at some point, or totally not there anymore. So it's important that our efforts are tracked. The restriction and plan is reviewed by the QDDP at least quarterly or at the request of the person, and at least annually by the HRC and BPRC if applicable. What supports could we put in place to prepare an individual to attend their HRC meeting should they choose to attend? Well, training and due process, and we know that's required, and not just training when they have a rights restriction, but let the individuals be trained before a rights restriction even occurs. They may never have a rights restrictions, but they need training and due process. They need to know how that fair process works. Understanding that the rights restriction is only temporary. It's not always going to be. Understanding of a plan of removal and being satisfied with that plan. Yes, I can work with this plan so that I can minimize this restriction. Benefits of target and completion dates, of course, and we already talked about that. Risk involved should the plan include physical holds to manage my behavior. Well, they could get injured, and they need to know that. Knowing that they have support to present any objection they choose to the restriction or provide any input that they choose at that meeting. Empowering people with education, giving them the confidence to want to attend the meeting. The restriction is about them, so we want them to be there to talk about their restriction. Now, let's talk about Indicator G, root cause. I wanted to look at Probe 4. Does the Human Rights Committee meet at least quarterly? So I did a poll of 5 agencies. I did not include case management because they are not scored in Indicator G. But I wanted to determine if the HRCs that the agencies in the sample have access to meet at least quarterly. In Probe 5, is the HRC composed of a majority of individuals that are not employed by the program? I included this because this is an area that is frequently cited by certification. So a poll of 5 agencies in the sample to determine if the majority of the members of the HRC they have access to are not employed by the program. And I also reviewed the certification reports of the agencies in the sample to find out if they were cited in this area. This is the results of that poll. I found out is 60% of the agencies in the sample have access to an HRC where the majority of the individuals are not employed by the program. That's good. I thought that was a pretty good percentage. Of course, improvement always is needed, but a good start, good baseline. What I did find out is 40% of the agencies had access to an HRC where the majority of the members were employed by the program. So definitely needs improvement. What I found out is 3 of the 5 agencies in the poll did have access to an HRC where we have the majority of the members that are not employed by the program. We want this to be a fair process. This is part of due process. And you want to have a committee that is impartial because it is a review of the restriction, not of the person. Good to have a good mix of individuals on that committee. What I did find out is the HRCs that meet quarterly, 100%. That's excellent. They all had access to an HRC meeting at least quarterly. So this, yay us. So what did I do with the information that I learned from my probe, my analysis, the information that gave me the improvements that we need in Indicator G? A DMH committee has developed a PowerPoint. It is now on our website. It is entitled Promotion and Protection of Individual Rights. It is for human rights committees, training on requirements of the Human Rights Committee. So they now have access to training, including the responsibilities of their committee, and also what groups are represented to serve as members. Here is the website, of course, www.mh.alabama.gov, and the link Community Programs. This training will be under DD Certification Tools. An excellent PowerPoint that covers the requirements of our HRC committees. Here's actually a slide from that PowerPoint. When agencies ask me about membership, they say, who can we get to be on our committee? It's a real hard one for us because we know that they're mostly volunteers and whatnot, don't get paid. But I always say people supported is someone that could serve on your committee. A person supported would love to be a member of the HRC committee. It gives them an important role, and also it gives them a chance to meet other people that are on the committee that are from the community. So all in all, a good thing for a person supported. And I know that most agencies have at least one person on the committee, but there's no rule to say that you can only have one. You can have two or three. Family members of individuals being supported. Maybe nobody's asked them to be on the committee, but certainly a good way for them to be more involved in the community as well and have an important role. Well, with all of this, of course, we want to be tracking the progress of these training tools, this PowerPoint for HRC committees and our individual rights training PowerPoint, honoring individual rights and our rights assessment. We want to know how many downloads we're getting monthly to see if agencies are downloading and actually and hopefully using these training materials. Our wonderful web designer, Peggy Olson, and the quality enhancement specialist, that would be me, are tracking the number of downloads monthly of these training tools. And we're going to be doing that for a while. Eventually, we're going to be tracking them quarterly. But here's an example of our tracking these tools monthly. Rights assessment was uploaded on the web in September, and we had 59 downloads in September. In October, we didn't have any. So encouraging you to please download the rights assessment, hopefully use it. Our Honoring Individual Rights PowerPoint was uploaded on the web in October, and we thus far, and we have 40 downloads of our individual rights training PowerPoint, honoring individual rights. Promotion and protection of individual rights, our PowerPoint for HRC committees, went on the web in July and started out with about 3 hits, and one of them was me, so I guess that doesn't count, but certainly by August we had 39. And then September we had 50 or so, and then of course slacked off in October with about 30. But that's okay. I mean, we're making some progress in people downloading our assessment tools, and hopefully, like I said, they're using them. I want to include personal outcome measures, national data. Eventually, we're going to be comparing our POM data to the national data of personal outcome measures. This result is the number in the sample was 8,223 interviews from 1993 to 2012, in the outcome exercising rights and treated fairly, I thought these percentages were low. We're talking about exercising rights being the most influential outcome. The outcomes present, according to this, is 50.5%, and the supports present for exercising rights was 48.1%. And treated fairly, outcomes present 56.2%, and supports present was 57.2%. Treated fairly, unnecessary rights restrictions. And you see the good arrow. Remember, the good arrow means continuous improvement. So these are two areas that we need to continually improve on. Exercising rights being so important, and the fact that people not having unnecessary rights restrictions, we want these numbers to be much higher, these percentages to be much higher than they are now. Certainly gives us something all to work towards, and that's all of us. Okay, evaluating progress. Evaluating our training progress. Remember, in our training in E and F, indicators E and F, we've achieved 33% of training in those indicators. But I'm looking at a goal. I'm looking at March 2015. And you know how you want to have a goal for the solutions that you're trying to put in place when you see a problem, when you're working on achieving higher. We've achieved 33% in training, but by March 2015, I want to double that. And now that we have that individual rights training PowerPoint, honoring individual rights on the website and our rights assessment, I'm hoping that we can improve that, double that, the 66% by March 2015. So that's my goal with making improvements in training. Attendance at HRC meetings. Well, with the supports that could be put in place for individuals to attend their meeting, we have achieved 15 people attended their meeting, but by March 2015, what about 30 people? And see our good arrow? Our good arrow means continuous improvement. So we want to keep this number increasing. But by March 2015, my goal is to double that, to have at least 30 people that have attended their HRC meeting. And our goal for HRC membership, to increase the non-agency employee membership in HRCs by 20%. Okay, so my goal by March 2015 is to increase from 60%, which we have that now, we've achieved that, to 80%. And I think this is attainable because I do have an agency that's hard working on this to get members from outside their agency to join their HRC meeting, and hopefully individuals supported. Now, evaluating progress. We're always evaluating. Are our solutions working? Constantly measuring. Is our plan working? Do we need to revise our plan? And now that I have these training tools in place and this assessment, I'm going to follow a focus group. And the agencies in the sample have agreed to become part of this focus group. Now, collect feedback from them by March 2015 because I want to know the effectiveness of these training tools, the assessment, if they're working for them, and if they're not, what do we need to do differently to improve them? And certainly I'm hoping that I will get responses from individuals supported regarding that rights assessment. And, of course, that the training tools, individual rights training tools, because it is training for them as well. So what they'll do, the focus group will present all of these training tools and use the assessment, and all the evaluation information that I get, I will share with you. Right now, we are looking at statewide email. There may be another way. Eventually, it could be posting responses on our website. We're still working on that. But you will get that information about those responses from the agencies in the focus group. What is my ultimate goal? I always want to have an ultimate goal. And look, here we are once again with factor 1, indicators A, B, C, D, E, F, and G. And what I want is at least in indicators E, F, and G, with these training tools in place, at least a 20% increase in agencies meeting the indicator. So in E, at 56%, which it was originally when we first had our data results, an increase of 20% to 67%. Indicator F from 56% to 67%. And indicator G from 64%, which are baseline data, to 77%. There's our good arrow. Once again, continuous improvement. And I know that we can achieve this. And I'm going to look by March 2015. I'm hoping to see this 20% increase. So how does my project support basic assurances factor 10? Well, certainly monitoring. Provide some excellent monitoring tools for providers. The rights assessment, certainly we talked about that. The individual rights training PowerPoint, honoring individual rights for training purposes, and how it's good tools to monitor basic assurances factor 1, and also with the HRC PowerPoint, the requirements, and making sure that HRCs are meeting the requirements under indicator G. The data sources, of course, were identified, our rights assessment, our training curriculums that we collected from agencies. Persons responsible for collecting and analyzing and tracking the data, those persons were identified, holding the people accountable for collecting, analyzing, and tracking data. Included types of analysis we performed. We did a comparison, drill down, quantitative. We turned data into information. And what that information told us about needed improvement, and information into action. The action steps that we took to work towards improvement in those indicators. Implementation. The implementation of the strategies we developed to make those improvements, and time frames. We gave ourselves time frames of when those things would be, the solutions would be implemented. But most importantly, continually evaluating progress to assure quality of services and supports in the promotion and protection of individual rights, and therefore enhancing the quality of life for people we support, which is our primary goal. And the journey continues. Thank you so much for participating.
Natural supports, maximizing the benefits. Good morning. My name is Connie Batiste, and we're going to be talking about natural supports today. I'd like to start with an excerpt from the Cheers theme song. Sometimes you want to go where everybody knows your name, and they're always glad you came. You want to be where you can see our troubles are all the same. You want to be where everybody knows your name. To understand the importance of natural supports, you need to know what natural supports are. Family is not just mom and dad. Family includes brothers, sisters, aunts, uncles, cousins. Friends are those two-way relationships. Friends can be the person you live with, but that's not automatic. Other significant relationships are boyfriends, girlfriends, sweetie, that very special someone. It's important to remember relationships are voluntary, not paid. Staff facilitate natural supports and are being paid to work with individuals. Natural supports make people feel like they belong. They encourage independence. You always know there's someone to depend on no matter what, through good times and bad. People feel secure. Natural supports also reduce the need to always pay someone for services. In 2012, in conjunction with Medicaid and home and community-based setting regulations, the administrative code changed and a new emphasis was placed on natural supports, which includes type and frequency of contact. Many of the individuals receiving supports have limited contact with their loved ones, have lost contact with people important in their lives, and lack the skill and opportunity to develop relationships. When this project began, we looked at the certification site visit scores of Factor 3, natural supports, for 64 agencies from October 2012 to October 2013. There were 3 areas that consistently received either progress noted or action required. Indicator A, which addresses policies and procedures for natural support systems. Indicator B, that speaks to recognizing emerging support networks. And Indicator D, that addresses facilitating each individual's desire, type, and frequency for natural supports. Results for each of the indicators for the 64 scores reviewed were: Indicator A on policies and procedures, 40 had effective results, 16 had progress noted, and 8 had action required. Indicator B on recognizing emerging support networks, 39 had effective results, 16 had progress noted, and 9 had action required. Indicator D on facilitating the individual's desire for natural supports, 37 had effective results, 14 had progress noted, and 13 had action required. For policies and procedures, 62 had effective results, 25 had progress noted, and 13% had action required. For emerging support networks, 61% had effective results, 25% had progress noted, and 14% had action required. For recognizing the desire for natural supports, 57% had effective results, 22% had progress noted, and 21% had action required. Two years and 132 scores later, Indicator A on policies and procedures, 72 had effective results, 37 had progress noted, and 23 had action required. Indicator B on recognizing emerging support networks, 76 had effective results, 31 had progress noted, and 25 had action required. Indicator D on facilitating the individual's desire for natural supports, 66 had effective results, 34 had progress noted, and 32 had action required. For policies and procedures, 55% had effective results, 28% had progress noted, and 17% had action required. For emerging support networks, 58% had effective results, 23% had progress noted, and 19% had action required. For recognizing the desire for natural support networks, 50% had effective results, 26% had progress noted, and 24% had action required. When comparing the first year of data with the data 2 years later, we get, under policies and procedures, year 1 we had 62% with the effective results. Year 2, 55% had effective results. Year 1, 25% had progress noted. Year 2, 28% had progress noted. In year 1, 13% had action required. And in year 2, 17% had action required. For emerging support networks, year 1, 61% had effective results, and year 2 had 58% with effective results. Year 1, 25% had progress noted. Year 2, 23% had progress noted. And year 1, 14% had action required. Year 2, 19% had action required. Looking at recognizing the desire for natural supports, year 1 had 57% with effective results. Year 2, 50% had effective results. Year 1, 22% had progress noted. Year 2, 26% had progress noted. And year 1, 21% had action required. And year 2, 24% had action required. Now these indicators continue to validate the need to make improvements. So what will it take to get better? Certification staff were asked what those agencies with effective results for all indicators under natural supports had that others didn't. All agreed that policies and procedures were the common factor. Each of the certification staff identified 2 agencies they considered having good policies. I reviewed 10 policies and picked out those things that they had in common. I also reviewed 5 policies from agencies with action required for all indicators under natural supports and compared them to those with effective results. The differences were obvious. These are some of the tips for a good policy and procedure. Your natural supports need to be clearly defined. Specifics on the scope of natural supports beyond immediate family and friends. Do the basic assurances self-assessment. Specifics on how the agency will support individuals to maintain contact. Specifics on how the agency will support individuals to reconnect. And do the basic assurances self-assessment. on how agencies will support individuals to develop the new relationships. Staff training on how to support individuals. Did I mention? Do the basic assurances self-assessment. Supports need to be based on individual wants, and there need to be specifics on how individuals will be involved with outside agencies. What do people really want? The only way you're going to find that out is to ask them. And then once you ask, you've got to act. You've got to follow through on the results. In August and September, 3 focus groups with 8 individuals receiving supports were conducted. The groups included individuals living with families, in group homes, and in their own apartment. They were asked 7 questions relating to family, friends, and significant others. Each person in the group defined their significant other as a boyfriend or girlfriend. My request of them was that we talked openly and honestly, and their request of me was not to tell who said what. And it was not because they were afraid of retaliation. They were concerned about hurting someone's feelings if they didn't answer a question that would be favorable. Each person was asked the same questions. They could only give one answer to be recorded. If there was more than one response, the one they felt was most important was chosen. I knew a few of the individuals participating and was not surprised they were willing to answer the questions. One individual I was familiar with but had never gotten more than a smile and a quiet hello. I was surprised that he was willing to participate, but I was even more surprised at how quickly he was to answer. I found out he had a lot to say. Each of the sessions took about an hour, and it was the most enjoyable and productive 3 hours I've spent in a long time. First question was, what do you like about the center? 54% liked seeing their friends. 25% liked the activities. And the activities were things like shopping, cookouts, movies, lunch in the park, picnics, and doing fun stuff. 13% said it was something to do. It was better than sitting at home. And 8% said they liked making money. Next question. What would you change about this center? 59% wanted better food. 33% wouldn't change anything. 4% wanted to make more money. And 4% wanted to be in a new building. When I asked, do you see and do things with your family, friends, significant others, the way and as often as you like? For seeing and doing things with family, 42% said yes. 58% said no. Doing things with friends, 12% said yes. 88% said no. Doing things with significant others, 29% said yes. 71% said no. The next question, does anyone ask you about friends, family, and significant others? Asking about family, 21% said yes. 79% said no. Asking about friends. 21% said yes. 79% said no. Asking about significant others. 8% said yes. 92% said no. The individuals that said yes to being asked about family and friends said their case manager asked them. The individuals saying yes to being asked about their significant others said it was by a family member. What do you need? What do you think you need to do the things you want to do as often as you want with your family? Supporters needed to do things with family. 36% felt that they needed transportation. 64% didn't know. What do you think you need to do the things you want to do as often as you want with your friends? 14% felt they needed money. 19% didn't know. And 67% felt that they needed someone to help them. What would you need to do things you want to do as often as you want with your significant other? 17% said money. 8% said they didn't know. And 75% said they needed someone to help them. Do you need more information about getting in touch with spending more time with or doing more things with your family, friends, or your significant other? 100% said yes. They needed more information about contact with family. 96% said yes to friends, and 4% said no. Needing more information and contact about significant others, 83% said yes, 17% said no. If you could do anything you wanted with your family, friends, or significant other, what would you do? This is the question the participants liked most. The hardest thing for them was deciding on just one answer. It was the same for each of the groups. Sometimes they heard an answer they thought they'd like to do even more than the one that they had given, and so they wanted to change their answer. Each person answered the question, but some of the answers were duplicated. So some of the things they said for family, they wanted to have family reunion, wanted to visit family in Florida, buy gifts for family members, go on a cruise, and one person just didn't know. For friends, they wanted to do things like dinner and movies, hang out, have barbecues, go on picnics, go fishing, have people over for dinner, go on a cruise, and go to a concert. With significant others, they wanted to do things like dinner and movies, go to the beach, just get to know them better, go shopping, cook for them, and to see them more often. Now, these are some of the best practices that are key in improving scores for Indicator B, which is recognizing emerging support networks, and Indicator D, facilitating each person's desire for natural support. First thing, you've got to ask to act. You really can't do anything if you don't know what people are wanting. Do the basic assurance and self-assessment. Have an understanding that relationships go beyond the walls of the home or the day program. Don't assume. Don't wait for someone to say, I want this or I need this. You go back to, you've got to ask to act. Be observant. Be persistent. Be supportive. And be willing to find ways to work it out. Make it work. Be flexible. And then document. So what's the payoff? Growth of social capital. Social capital relates to social connections between people. It's about relationships, trust, shared values, give and take, cooperation, and information. Social capital is trusting relationships that allow you to support one another and add to your quality of life. On the CQL website, there's a 2-minute video that sums up social capital and the importance of asking and acting. Relationships matter. CQL came up with a method of measuring the properties of social capital called the Social Capital Index. The Social Capital Index has 8 outcomes from the Personal Outcome Measures database. The outcomes were analyzed for reliability and validity, and a factor analysis of the outcomes resulted in 2 factors being identified and named: bonding and bridging. Bonding social capital are the social ties that link people together with others who are primarily like them. And those personal outcome measures that come under the bonding social capital got 5. People have intimate relationships. People participate in the life of the community. People have friends. People are respected. And people remain connected with natural supports. Bridging social capital are social ties that link people together with others outside of their normal social circle. And there are 3 bridging personal outcomes. People live in integrated environments. People interact with other members of the community. People perform different social roles. From CQL's National Personal Outcome Measures database, I compared the 3 bonding outcomes specific to natural supports with the responses from the focus groups. As I said before, the results show that these indicators need to make improvements. Better Together is an initiative at Howard University that came up with a list of 150 practical strategies that could be used nationally to increase Americans' connections with each other. Some of the things on the list were people registering to vote, volunteering skills to an organization, planning a vacation, participating in a cause, walking or biking. There's a chance to meet others. Calling an old friend, hosting a movie night, asking neighbors for help, and reciprocating. Most of the items on the list involve nothing more than putting yourself out there. These are things anyone wanting to build social relationships can do. They encourage you to try some of them on your own, and then you can submit ideas to add to the list. And some more things that added to that list were volunteering to deliver Meals on Wheels in the neighborhood, talking to friends and family about social capital and why it matters, signing up for a class and meeting classmates, offering to do something for your neighbor like raking the yard or shoveling the driveway. So how does this relate to Factor 10? Monitoring systems have been identified. We've identified our data sources. We've shown how this data collected can be turned into information, and then there's some insight on turning that information into action, and then information on how that action will enhance services. Some final thoughts on natural supports and a few of the comments made by the individuals during the focus group sessions. Everyone deserves relationships with people not solely paid to be there. Relationships should be based on choice, not circumstances. Receiving supports has nothing to do with people having and maintaining meaningful relationships. Developing natural supports does take energy, but the benefits are priceless and can last a lifetime. Some of the things that people were saying that they had interest in. Someone said that they wanted a boyfriend. I want to take my girlfriend to dinner and the movies. I want to put flowers on my sister's grave, but I don't know where she's buried. Can you ask someone if we can go on a date? Sure, I've got lots of friends. I see them here every day. It would be great if they could come to my house. My daddy's in a nursing home. I pray for him. I hope I can see him next week. Oh yeah, do the basic assurances self-assessment, and please follow through with the plan. Thank you.
Hi, I'm Mike Horshock, the Quality Enhancement Staff for Region 2. The focus of my CQA project is on the non-negotiables and related requirements. The non-negotiables refer to those fundamental requirements and expectations of us human service providers to ensure that strong systems and practices are in place which promote people's health, safety, and security. Non-negotiables are specifically identified in the state standards under Factor 4, which is protection from abuse, neglect, mistreatment, and exploitation. Factor 5, and Factor 6, safe environments. These particular factors require 100% criteria for all respective indicators, thus the term non-negotiable. Factor 11 is the +1 that I mentioned in my title, and it captures expected practices associated with protection, health, and safety. However, each indicator is scored as either effective results, action required. We know that we cannot prevent all risks, but we do need to have a system to reasonably identify and act on possible and potential risks and support needs in order to minimize and manage those risks. To assess how well factors 4, 5, 6, and 11 have been addressed, I conducted a review of 69 statewide providers' certification scores that they received from October 2012 to November 15. The graph that you see represents the percentage of agencies meeting the indicators. As you can notice that on factors 4, 5, and 6, that many of the providers have reached those goals, achieved those indicators, but on factor 11, the scores are much lower. Looking a little more closely at factor 11, we notice that indicator A refers to the IPMS practice and procedures, and factor care help needs addressed in a person-centered plan, including age and gender-specific and preventive screening, medication storage, and documentation. And indicator 11C refers to Now, one thing that you may have noticed that has occurred is that some issues have been put into factor 11A, B, or C from factors 4, 5, and 6. And what occurs here is that in factor 6, their certification staff are mainly looking at systems issues. And so some issues that may occur that are more isolated or individual concerns placed into factors 11A, B, or C. In an attempt to identify possible root causes of the performance concerns within factors 4, 5, 6, and 11, an analysis of the data was conducted from a regionally representative agencies with action required or progress noted issues. The most frequently and similar cited probes in analyzing the data for factor 4 and 11A, of the 25 provider reports reviewed, the most issues were sorted into 3 categories based on common themes. There were a total of 16 probes, 9 of which fall under internal investigations. 4 categorized as incident review process, and 3 of those citations fell under evaluation of potential underreporting of assault, neglect, mistreatment, and exploitation. The actual probes or comments that were cited under internal investigations had to do with policies and procedures, either investigations concerning policy and procedures were not available or not consistent with the standard DMS guidelines. There were reporting incidents in required time frame. There was some late reporting, investigating allegations, follow-up on the recommendations from the investigations not available, and staff training on conducting investigations not available. Category incident review process, there was no incident review process to analyze data. And then for evaluation of potential underreporting, there was no documentation related to evaluating potential screening of allegations. Now, although there were only 3 cited comments under the category evaluation of potential underreporting, there is some information that I've discovered that makes this an area that we really need to look at very closely. And findings from a 2012 project from the Disability and Abuse Project organization, and the survey was conducted on abuse of people with disabilities. It revealed more than 70% of people with disabilities, or over 958 respondents, said they had been 73% of those said they had been bullied at some point. Concerning is that nearly 2/3 did not report it to the authorities. Reasons for not reporting, including futility. They basically believed nothing would be done. They were threatened, or they were too afraid to report. And then lack of information. They just weren't sure who or where to report. Concerning survey and information, and I think it's an area that we need to look at real closely to ensure that we are capturing any possibility that people may be abused. With regard to Factor 5 and 11B, which has to do with best help, there were 21 common issues which fell into 3 categories, 8 of which related to documentation of health needs and concerns, 7 related to supports to manage own health care, and 6 were categorized under administration of medications. And specific cited probes under these areas with documentation of health needs and concerns. There was no documentation regarding actions to address health needs, no documentation indicating preventive health needs, and no documentation of follow-up on category supports to manage own health care, the person's evidence people were supported to manage their own health care. Of medications, there were basically medication issues, incorrect counts, unreported medication errors, issues, and expired medications not disposed properly. Factor 6 and 11C, which refers to safe environments, there were 16 commonly cited issues grouped into 2 categories. 9 of the citations were housekeeping and safety monitoring issues, and 7 were citations related to individualized safety. These specific issues had to do with monitoring was lacking or not formalized, and records of repairs and maintenance not available. Individualized safety and emergency plans, the safety assessments and emergency plans were not available, or they were just incomplete. An area to mention under the individualized safety, agencies were noted to be issues and concerns and safety needs. They were forgetting to also address the community safety needs of individuals. So that's the desired outcome for this project is to provide people receiving services and supports, providers and stakeholders with information and tools which support people to be free from harm, best possible health, and live in safe environments. How working toward and achieving the outcome will support our CQA mission, which is to utilize data to enhance the quality of life of people who receive services. One is that ensuring people receiving services and supports are living in safe, enhance their exploration toward and attainment of desired quality of life. So as they're feel healthy and feel safe and secure, they're more likely to take risks and to want to do new things. The second area is that agencies can enhance their ability to monitor and evaluate basic assurances system associated with people's health, safety, and personal security. So it's an opportunity for people to look at their basic assurance plan and understand data and analyze it and put the information you learn into action and supports. The way that I went about trying to identify potential solutions is I talked with education staff to try to identify agencies who have good sound monitoring systems, and so I contacted some of those to try to identify what are some of the areas that they covered, how they went about doing that, and also received some of their tracking forms and information so that I could also be able to share that with other agencies. I did some research about what are some of the available best practices regarding guidelines for individualized primary health care needs, and I compiled an array of safety assessments that were online. I've tried to identify some potential solutions and tools for each of the factors and the noted categories. One thing to keep in mind that these are basically recommendations. They're not necessarily endorsed by the department. Suggestions and recommendations and not something that is mandated by the department. With regard to Factor 4 and 11A, frequently cited issues under the category internal investigations, it is recommended that providers consider maintaining a tracking grid for reported allegations through closure. Your Human Rights Committee to review allegations and investigations. And although the standards currently state that they should be reviewing any substantiated allegations of abuse and neglect, I think from an enhancement standpoint, I would encourage that human rights committees also look at allegations as well, not just substantiated allegations. Recommend that all staff, if they haven't already, that they go through the departments conducting serious incident investigations. That website is mh.alabama.gov. And you can get information about when that training is available. Looking at now is just a simple example of an investigation tracking form that you might want to consider utilizing if you don't already have one available. The column that refers to recommendations and staff responsible, that would be an area where you want to indicate what your corrective actions as well as preventive actions you're going to utilize based on investigation findings. Column that's not on here that you might want to consider strongly including is a follow-up column. Assess the effectiveness of the corrective actions. And that way you can keep up with not only once you identify reports, but you track it all the way through to completion. Of course, identifying incidents is a very important part of incident management. However, really in order to fully protect persons served from harm, a strong oversight and response system in place. In addition to identifying those particular reports, you ensure that you have a tracking mechanism and periodic reviews of individual and aggregate data to assist determining any kind of patterns and trends that might be occurring. Again, another simple example of an incident tracking form. Main things to keep in mind is issues like what, when, where, who, and the agency will respond. But again, this is just a simple incident tracking form that should assist your agency in keeping up with incident. The category of evaluation of potential underreporting of assault, mistreatment, and exploitation. We're basically looking at the program of supports designed. How are we educating staff and persons receiving services on signs and symptoms of abuse? And what resources that are available include that was distributed back in 2009 on signs and symptoms of abuse. This came from the division, the enhancement division, and those are still available through your regional QE staff. There is a site that relates to initiatives that the state of Florida actually implements, and you can identified as prevention and safety planning. Earlier about the Disability and Abuse Project. There's a link available from that survey. Thing to keep in mind is looking at accidents and minor injuries, unexplained injuries, as considering to initial interviews and surveys with staff and people receiving services. Concerns is through the personal factors which might deter them from reporting. Retaliation is this. If they do report, they're automatically going to be situations that they will be able to give information candidly and not fear any kind of. Certainly consider conducting random unannounced monitoring of homes, the activities, and especially late at night. You know, the staff get used to people coming right at administrative staff initial shift, but being late at night, you can learn a lot more about what's build people's circle of supports, their natural supports, increases their safety net, and possible steps into your training on assault and neglect. Idea of what it might look like and whether or not they can identify based on those vignettes is actual abuse and neglect. People with disabilities, which this empowerment wheel for people with disabilities is an awareness and education tool designed to enhance people's abilities to self-protect from abuse. Now looking at Factor 5 and 11B. These are potential tools available to assist in identifying a person's health concerns and needs. So the first part is, have a comprehensive process for identifying their individualized best health needs. Again, some available resources are the POM interviews, utilizing your annual physical report, resources available online through the Department of Health and Human Massachusetts Department of Developmental Services adult screening resource material. Particular material was actually sent out back in 2006 to providers. Actually updated in 2012. Massachusetts as a state standard for the provision of health care services to the individuals at number 4 under the Massachusetts resource checklist, and this is actually designed for direct support staff to complete, so it's an opportunity for needs might be health-wise. For community providers that provides information on commonly under-recognized. After identifying a person's health needs and desired best health, you got to have a system in place to manage and monitor the needed health care and overall. Recommendations and tools include periodic records where you can do an internal audit of your system for having a QDDP checklist so that when your Q does their quarterly reports, it'll kind of be a red flag for them to ensure that they monitor the staff training on recognizing acute health changes and crisis and reporting daily review of the MAC worker call log. And again, this is not something that's mandatory, but it would be helpful in identifying any follow-up needs. Practitioner encounter form and procedure for a medical appointment. These are staff and for tracking forms to utilize. Practitioner encounter form, that form all checklist at the bottom of who the information was communicated to after the person gets back from the doctor. Changes in medication were addressed and other issues such as that, so that you ensure that there is follow-up on what recommendations may have occurred from the then internal review of serious injuries and hospitalizations, having some kind of health or human rights committee look at some of those concerns. Has occurred and it was responsible and just a sample checklist for quality assurance purposes. Next. And then you have the checklist. Another checklist, basically the same one, but just looks at the systems issues, and it can be used for your basic assurance data system. So you can Factor 5 and 11B with supports to manage on health care, what we're talking about. Supports to manage own health care, we're talking about people self-directing their health care, able to self-determine what kind of health care they receive. Although this is a relatively new requirement under standards, it happened to be a third of the reasons why many agencies did not score. Basically, you want to support people to have input into things such as the date and time of medical appointments, choosing healthcare providers, to be able to have better understanding about their health condition and needs, their treatment expectations and risks, and any treatment options. It's all about make reasonable decisions about their health care. Mechanisms need to be in place that effectively ensure adherence to the nurse delegation program requirements. So, administration of medications, ensure that you have policies and procedures, delegation program requirements. What I've seen from certification reports is that they've updated their policies and procedures, and things have changed fairly recently. Errors by an agency oversight committee, negligence and or serious reaction that may have occurred from medication errors, and also obtain sufficient data tracking to identify patterns and trends in medication errors. So might be occurring. Example might be one where periodically some medication go missing, and it may not seem like a big deal because it happens relatively infrequently, but you may begin to kind of notice a pattern. It may be only when a particular staff is there. Issues. So it is worth a sample form here again of tracking that kind of information. As the same type of form, but utilizing it for monitoring your basic assurances system-wide. Under Factor 6, 11C with safe environments, category housekeeping and safety monitoring. There are opportunities for information that's available, such as maintain a tracking mechanism to ensure resolution, conduct routine inspections, on a program site. Sometimes we forget about, checking the vehicles to make sure the seat belts are working properly, chairs to ensure that they're functioning properly. Also, wall type things on the bottom of their walkers. Practically looking at people's helmets, making sure that on the inside there's not any tears that might cause some scratches or abrasions. Looking at furniture. Samples that are available that you can get from. Include individuals in performing safety inspections. This is a great opportunity to get people's input into repair and safety concerns. Examples of those that you can include review of reported concerns as a fixed agenda at your internal committee meetings, such as your basic assurance committee meeting. That way you can ensure that these things are getting followed up on and in a timely manner. Safe environments with Factor 6 and 11C. Safety assessments and emergency plans. Again, some things that you might want to consider is to complete individualized safety assessments and emergency plans and review annually at the person-centered plan. Safety plan whenever the person's concerns or needs require additional supports, such as issues when a person might fall and now they have to use a walker. Well, plan to keep them safe. Any kind of environmental concerns, neighborhood that resources are for assessments. Agency called Growthways has a very good resource. eldercareteam.com reminds us that as we get older, there are certain needs that we have as well, and such as night lights and maybe grab bars. Information about issues to address. And then also from FEMA, there's a lot of resources, information available there, addressing fire plans for people with disabilities, more awareness, education, and training on best practices. The expectation is that agency scores will improve. Statewide average scores will be minimally at 80% or at least receiving progress noted by the end of 2015. Next steps that I'll be using to ensure that this training is effective is there's going to be some more training on best practices related to the home and safety inspections, individualized safety assessments, identifying potential underreporting, and measuring the success of training by comparison scores from factors 4, 5, 6, and 11A, B, and C. And then I'll be creating personal outcome measure data with national POM data as an additional assessment of the overall success of desire is for state POM scores to match or exceed the national averages in the noted POM outcomes and supports. What you're seeing now is a national percentage of personal outcomes and supports, CQL. And we hope to, as we begin to compile compile this information from certification staff interviews as well as QB interviews. We're going to utilize that information as a way of comparing statewide POM data to the national data. So back to our expectations. Hopefully providers will enhance their ability to monitor and evaluate the basic assurances, and that we will ultimately ensure people receiving service and support and have the best possible health, and that over time this will enhance their education toward and attainment of desired quality. And ultimately, what we hope to accomplish is that agencies will be more prepared to develop their basic assurance plan and understand more monitoring opportunities.
Okay, thank you. Hello, my name is Patricia Bailey, and I'm the Quality Enhancement Specialist for Region 1, and I am happy to be here today with you to present information on recruiting and retaining the right staff, analyzing and managing employee resources and supports. This project reviewed data from certification reports for November 2012 to October 2013. Analysis of the data identified areas by basic assurance factor and indicator that offered quality enhancement opportunities for agencies. This CQA project looks specifically at Factor 7, staff resources and supports. A survey was developed and fielded to gain insight into staff recruitment, retention, and training practices used by the Alabama Department of Mental Health contractual providers in order to identify current practices and challenges they face. As a result of this project, informational resources have been developed and best practices identified and will be presented here. Just as a reminder, Factor 7, specific areas of data collection reviewed in Factor 7, which is staff resources and supports, were Indicator A, the organization implements a system for staff recruitment and retention, and also Indicator D, the organization implements an ongoing staff development program. Indicator A probes include recruiting and hiring staff in accordance with all applicable laws and agency requirements, conducting reference checks, background checks, and pre-employment drug testing. Agencies refrain from hiring people with felony convictions. And then an Indicator D probes include conducting orientation and required annual training, documentation of required and refresher training, and providing training that reflects input from people support and their families. So let's take a look at how we're doing in Alabama. Based on the evaluation and analysis of the Alabama Department of Mental Health data collected from 69 statewide certification reports conducted through October 1, 2012 through November 11, 2013, show that 31% of agencies reviewed for certification scored less than 80% on Factor 7. The organization implements a system for staff recruitment and retention. Also, when looking at the data, 62% of agencies reviewed for certification scored less than 80% on Factor 7, Indicator D, the organization implements an ongoing staff development program. So we asked then, why do we analyze the data? What will it tell us? Human resources and the competencies of people employed by organizations represent the greatest assets and challenges for organizational management. Also, human resources are the primary method for ensuring that services and supports lead to personal outcomes for the person being supported. Staff must also have the knowledge, skill, and competency to facilitate outcomes, respond to, and satisfy needs in the service delivery process. And constant reevaluation of employee knowledge, learning, and support needs promotes the attainment of personal outcomes for the person. And also, according to Bill Gates, the world's foremost philanthropist and serious analytics advocate, he has said, "I have been struck by how important measurement is to improving the human condition." Gates told the Wall Street Journal in a recent interview, "You can achieve incredible progress if you set a clear goal and find a measure that will drive progress toward that goal." So then we look and we ask ourselves, why does turnover matter for agencies? And it affects the agency's performance. Researchers have found that high turnover rates can produce shortfalls in agencies' performance. It shows that high turnover among employees with extensive social capital can dramatically erode agency performance. Turnovers are tougher on small agencies and organizations since departing employees are more likely to be the only ones possessing a particular skill or knowledge set. A small organization's culture suffers a more serious blow when an essential person leaves, and there is a smaller internal pool of workers to cover that lost employee's work. So the organization may have fewer resources available to cover replacement cost. The financial cost of employee turnover. When we look at all the costs connected with employee turnover, including interviewing, hiring, training, reduced productivity, loss of opportunity costs, we find that the real cost to an organization for entry-level employees, it costs between 30% and 50% of their annual salary to replace them. For mid-level employees, it costs upwards of 150% of their annual salary to replace them. And for high-level or highly specialized employees, you're looking at 400% of their annual salary. In a recent article on employee retention, it outlined factors that a business should consider in calculating the real cost of losing an employee. And this was written by Josh Burson by Deloitte. And these factors include the cost of hiring a new employee, including the advertising, interviewing, screening, and hiring. It includes cost of onboarding a new person, including training and management time. There's loss of productivity. It may take a new employee 1 to 2 years to reach the productivity of an existing person. There's also a loss of engagement. Other employees who see high turnover tend to disengage and lose productivity. And also the customer service and errors, for example, new employees take longer and are less adept at solving problems. And training costs, for example, over 2 to 3 years, a business likely invest between 10 and 20% of an employee's salary or more in training. And then the cultural impact needs to be considered. Whenever someone leaves, others will take time to ask why. So all of these factors are important when looking at the financial cost of the employee turnover. Now let's look at a matter of personal autonomy. Choosing staff affects the personal outcomes for the people that we support. So why is getting involved in choosing staff important for the person receiving supports. A review of the research literature identified two basic reasons. The first is the easy answer to why involve is because it means you recruit better staff. There's a better fit there between the person receiving supports and the staff being hired. Also, choice-making opportunity is a strong predictor of self-determination. So a person's self-determination status predicts higher quality of life, and as a result, a better chance of achieving those personal outcomes. Supports to make informed decisions and facilitate choice. Just to give you a little information from professionals in the field, the Executive Director of the National Alliance for Direct Support Professionals, Mr. Joseph M. Macbeth, believes that direct support professionals now more than ever will be front and center in building social capital, helping with finding and keeping meaningful employment, promoting social inclusion, working closely with families in the family home, all the while still supporting safety assessing risk and promoting choice. If the new CMS community rule opens the door to the community for people with disabilities, then it's the direct support professionals who will be helping go through that door. So that's an important factor to remember. So when we look at Alabama, who really has the choice in Alabama? This graph, which was provided by the National Core Indicators, it was a result of a survey that was completed from input from people who receive supports. And what you can notice from this, first of all, in the area of choosing staff, the proportion of people who make choices about their everyday lives, including roommates, daily routine jobs, support staff or providers, what to spend their money on. These are the kind of decisions that we're discussing here, including that choosing support staff providers. And what we can see from this graph is that for the state of Alabama, 54% of people are having choices made by someone else. And that's a critical factor when considering self-determination and personal outcomes and how staff can play a part in that. But if they're not being a part of the choice process, then we have to look at that. As you can see, this was strictly Alabama participants who were surveyed. And if we take a look and break that down just a little more, in Alabama, the number of respondents for this survey were 395. And the average who chose their supports was 45%. When you compare that with the all participating states, and there are 25 participating states with the National Core Indicator who participated in the survey. So just to let you know that 10,886 participants responded nationally, and of that number, 62% chose their own support staff. So this is a significant comparison in that nationally 62% are choosing their own staff as compared with Alabama, where we see that 45% of people being served are choosing their supports. As a result of all of this information, I developed a survey in order to look at how our agencies are facing this issue of choosing staff and staff turnover. So what I did was I created a survey and fielded it to gain insight into staff recruitment, retention, and training practices used by the department's contractual providers in order to identify current practices and the challenges that they face. Sharing experiences and practices in the area of staff recruitment, retention, and staff training will provide valuable insights that will enhance the services we provide to the people that we support. As far as the methodology, 2 agencies per region were selected based on their scores. A survey was developed and a letter was sent to 10 agencies that contract with Alabama's Department of Mental Health. 9 agencies responded, and the survey was fielded in July of 2013. And here you'll just see just a copy of the survey letter that was sent to agencies requesting that they participate in this survey because it can be a great asset to them as far as the information that's provided and how we turn that information into action. And this is just a sample of the survey, which looks at different questions, different areas, including staff recruitment methods and questions about their staff retention, you know, as far as how they addressed issues concerning how employees felt about their jobs maybe 30 days after being employed. Survey findings, when we look at the demographics of the staff that were hired, staff gender, for every 6 females hired, 1 male was also hired. As far as staff age, the ranges were 32% ages 18 to 25, 28% for ages 26 to 34, 23% represented ages 35 to 45, and 17% were between the ages of 46 and 68. Survey findings, 9 of 10 agencies that contract with the Alabama Department of Mental Health Division of Developmental Disabilities responded to this survey. Of responding agencies, almost half, 44%, do not track referral sources, whether they're internal or external, such as current or former employees, newspapers, internal posting, former employees, former intern or volunteer for agencies before being hired. 2/3 of those agencies that do track referral sources used mostly external sources, such as federal, state, and local job centers and newspaper ads. Also, 86% of employees who left these agencies during 2012-2013, either voluntarily or involuntarily, had worked for 6 months or less. These are some of the questions that were asked in the survey with the results. Regarding staff retention responses, does your agency conduct employee satisfaction surveys? 78% said yes. Does your agency conduct exit interviews when employees leave voluntarily? 100% said yes. Does your agency conduct new staff surveys after the first 30 days of employment to assess employees' job satisfaction? Overwhelmingly, 78% said no. They do not conduct any type of job satisfaction survey after the first 30 days of employment, which I think is fairly significant in the findings. Also, we ask, in your professional opinion, does recognizing employees for their accomplishments provide employees with a clearer understanding of your agency's objectives? 78% again said yes. And then, does your agency have an employee recognition program? Well over half said no. They do not have any type of employee recognition program. In your professional opinion, is the orientation and training provided to direct care staff effective? 100% of surveyed agencies said yes. is your agency staff training program based on input from people who receive supports and their families or legally authorized representatives? And 67% said yes. Part of the survey asked questions about what agencies saw as the most important human resource challenge that they would face. And the number one challenge was that agencies surveyed said was employee satisfaction. So we can see that there is an issue there with not understanding the connection between surveying your staff after their first 30 days and then looking at employee satisfaction overall. Another factor identified by agencies as a challenge was recruiting qualified candidates. 78% said they saw this as a challenge for them in the future. And there are a lot of factors that play into that as far as it being a challenge. In the smaller areas, smaller communities, just having the availability of people to respond to ads was mentioned as an issue for small agencies. And the third important human resource challenge identified was employee engagement and commitment to the agency. More than half saw that as a challenge. So what are our findings then? A third of agencies are facing challenges implementing a system for staff recruitment and retention. More than half of agencies do not have an effective and ongoing staff development program, and over one-third of agencies do not seek input from the people they support when developing their staff training programs. Also, a majority of agencies report that employee satisfaction is their number one human resource challenge. An overwhelming majority of employees who left these agencies during 2012 and 2013, whether they left voluntarily or involuntarily, had worked for 6 months or less without the agency's assessment of job satisfaction after their first 30 days. And then more than 80% of agencies feel that recruiting qualified employees is also a significant human resource concern. So how do we respond to what we have learned? We have identified some tools for enhancing agency staff recruitment, retention, and training, and this is based on research that has been identified within the last 10 years that is effective. One is to involve people receiving supports from your agency in the processes of staff recruitment, retention, and training. And that involvement could be anything from asking the person to participate in the interview process of candidates. It could be if the person doesn't want to participate in the interview process, they could also write a list of questions that they feel would be important to ask. There are several ways to involve the people that you support in that process. Develop a sample structured list of questions to measure the competencies of candidates for employment based on the experience that the person may have, or in trying to understand what experience that person might have working with people with developmental disabilities. Also, development of a new staff survey to be administered after the first 30 days of employment. The questions should focus in part on how closely the new employees' experiences in the first 30 days match their expectations. This was recommended by the University of Minnesota's Research and Training Center on Community Living as one effective way to really make your recruitment and retention more effective. Also, just routinely, tracking the data, recruitment referral sources and its relationship with retention. Also training on CQL's Rule of 7. It's a guide to sustaining direct support professionals. Let's take a look at that. One is to recognize and understand the personality, preferences, cultural, and abilities of the direct support professionals. Understanding what is important in their lives and their culture and their work setting. Set expectations in terms of personal outcomes, those for the people with disabilities and those for the direct support professionals. So you're making sure that direct support professionals define quality in terms of personal outcomes and not by conformity for organizational rules or their job descriptions. And in the same manner, you assist the direct support professionals to articulate their own personal goals and objectives. Number 3 is replace management with leadership in guiding direct support professionals. Management through organizational hierarchies, rules, and job descriptions simply won't work. Provide mentors during the initial period of employment and then develop relationships with your direct support professionals that will emphasize responsibility and accountability for decision making. 4, promote opportunities for creativity and innovation by dropping firm anchors in protocols and procedures to prevent abuse and neglect and promote people's best possible health and facilitate safety and security. By having those protocols and procedures in place that direct support professionals are very familiar with, allows room to exercise creativity and innovation. Number 5, provide direct support professionals training in generic skills such as problem solving, negotiating and then time management, and community resource development. It's important for staff to understand what resources are available in the community when you're looking at ways that the person who's receiving supports can be better involved in their community and develop that social capital that's so important to their success. 6, provide direct support professionals training in positive behavioral supports, promotion of legal rights, advocacy, and the use of alternative technologies to facilitate community and mobility. And finally, 7, promote inclusion of direct support professionals in their own communities. Inclusion for people with disabilities will require that direct support professionals are part of their own communities. Organizations can encourage direct support professionals to establish their own linkages with their communities by becoming engaged in the cultural, religious, social, economic, and civic community organizations. This rule of 7 is just another way of trying to support agencies as they look at how they can be more successful in staff recruitment, retention, and training. Please feel free to contact me if you need more information about this presentation. I'm so happy that you are here today. Thank you.
All right. Good day, participants. Today we're going to talk about moving from words on paper to living life unscripted. As we go through the PowerPoint slide, you'll find out why I chose this title for this presentation. My name is Kimberly Morissette. I am the Quality Enhancement Specialist in Region 5 for the Department of Mental Health. When you think about your own life, you ask yourself, like, what makes life fulfilling for you? What makes your life exciting? Who's important to you? What things in your life cause you to want to get up in the morning? And our lives, our daily lives are filled with all types of uncertainties. And we just roll with it as we go from day to day. We can try to plan and try to be prepared for the unexpected, but when unexpected things happen, we have to take a few moments, gather ourselves, and say, okay, how am I going to deal with this particular circumstance that has come up in my life? I chose to put this little picture in there because it perfectly describes what each of our daily lives look like. We have diversity in our lives. We deal with successes. We deal with failures. We deal with collaboration, talking with our coworkers, our friends, our family. We deal with technology on our jobs. We have to work with other people. Our lives is just full of all types of different opportunities that cause us to feel fulfilled in our daily lives. What is our focus with this particular presentation? Why are we focusing on this, and what's the benefit? Well, first of all, our focus is, a few months ago, we started a process of reviewing data across the state. The data was taken from agencies across the state. Their recent site visit, the site visit was from October 2012 to November 2013. In the area that we're focusing on in this presentation is going to be Factor 8. Why are we focusing on Factor 8? Well, we're focusing on Factor 8 because there were 3 areas that scored the lowest in Factor 8. And as we go through the PowerPoint, we'll talk about each of these 3 areas. This section of the training, however, focuses on Factor 8, positive services and supports, and we're looking at indicators D, F, and G. We focus on these indicators because each of these indicators scored the lowest overall. So what's the benefit? As we go through and look at the areas where we didn't score so well, and we talk about maybe the things that didn't work, and we go forward to talk about things that we can do to get better, it will help the overall morale of the agency and also help with enhancing the lives of the people we support. So we will move from the words that we put on paper to people being able to live their lives unscripted like we do every day. Factor 8 focuses on positive services and support. Indicators D, F, and G, as we will talk about throughout the remainder of this presentation, 8D focuses on people's individual plans lead to person-centered and person-directed services and supports. Factor 8, indicator F, focuses on organizations monitor the effectiveness of each person's person-centered plan. Factor 8, indicator G, focuses on organizations provide positive behavioral supports to people. This is how we came up with focusing on factors 8 indicators D, F, and G. As you look at the graph, you see that the other areas, A, B, C, E, H, and I, they all scored above 79%. Some of those areas were almost perfect at 95, 97%. But when we get to factor D, our score overall was 55%. In factor 8F, it was 55%, and 8G got a little better at 59%. But our threshold that we wanted to meet was at least 60%, meaning 60% of the agencies was meeting these requirements. And as you can see, we weren't meeting the requirements. This slide talks about, it's just a statewide view. As you can see, we have a scoring system of 0, 1, and 2. 0 being the agency received action required, 1 being the agency received progress noted, and 2 meaning the agency received effective results in each specific area. As you can see, if you look at it from a wide range view, it looks like overall in Factor 8, everybody did well, but as we broke it down to each individual indicator, that's where we saw that we weren't doing so well as it looks on this graph. When looking at factors 8, indicators D, F, and G specifically, this is what the baseline data showed us. It showed us that 41% of agencies across the state received effective results in the areas of D, F, and G. This is looking at them collectively, the agencies, how they scored in these 3 areas collectively. So 41% receive effective results in all the areas of 8D, F, and G. 29% of agencies across the state received progress noted in the areas of 8D, F, and G. And 30% of the areas across the state, agencies across the state received action required in areas D, F, and G. So what did the data tell us as we looked at it even further? Well, according to the baseline data, 59% of the agencies reviewed across the state did not receive effective results in factors 8 indicators D, F, and G. So more than half of the agencies across the state that were reviewed didn't get effective results. Only 41% of all the agencies reviewed achieved effective results in factor 8 indicator D, F, and G. So that says that, over half of us kind of missed the mark with in these areas. So how do we go about changing that, making that better? If only 41% of the agencies reviewed achieved effective results. So we're going to take a look back at what we saw as we went and looked at each particular agency. So this next section, we'll just look back at 5 agencies that either scored action required or progress noted in the areas of Factor 8 indicators D, F, and G. And I'll remind you that Factor 8 focuses on positive services and supports. Indicator D focuses on individual plans lead to person-centered and person-directed services. Indicator F focuses on organizations monitor the effectiveness of each person's person-centered plan. And indicator G focuses on organization provides positive behavioral supports for people. So we're going to take a few moments and look at 5 agencies, and each agency was randomly selected. I chose one agency from each region based upon the score. And again, the score was either action required or progress noted. After the agencies were selected, a review of their site visit report was conducted to determine what, if any, trends were discovered across the state. Okay, we're looking at Factor 8 indicator D. When we looked at each agency that was selected, what we found was the common trend we found in this particular indicator was the person's preference did not lead to their goals. And when we look at it specifically, we look at 5 out of the 5 agencies that were selected. They were cited for deficit-driven goals instead of person-driven goals. 3 out of 5 of the agencies assessed the person's desire for increased natural supports, but had no supports in place to assist the person with accomplishing that. 3 out of 5 of the agencies did not promote satisfying relationships for people. 5 out of the 5 agencies reviewed did not include information gathered from their assessments in the plan. 5 out of 5 of the agencies reflect plans reflected a person's dreams and desires, but opportunities for learning did not. So what this basically says is that we're asking people, what is it that you want to do? What is it that you desire? Who do you want in your life? What's important to you? But it's not being carried out when it comes to our services. People are receiving opportunities to learn based on their deficits, based on what they don't know, instead of what their desires is to enhance their lives. People have relationships. When it comes to natural supports, it's saying that we know what type of relationships that people want. Agencies are asking, who do you want? What type of friendships you want? Who's important to you? But once they're told, then nothing's really being done to say that we really pushed and really tried to help this person cultivate that relationship with those people important to them. And when we talk about satisfying relationships, it just says that people have people that they may see, friends they may see only at their day program, friends they may see only when they go to church, friends they may see only when they go to the bowling night or the dance for people with disabilities, but they're not doing anything outside of that. And then we're getting the assessments. We're asking the questions. We're talking to people. However, it's not carried over into the plan. The plan does not say this person is assessed for, A, B, and C, and our plans to help them, improve in these areas or help them accomplish this goal is A, B, and C. The plans talk about what a person's dreams are, what their desires are, but when it comes to the learning opportunity programs or the ATP trainings or the objectives or whatever they're being called in each individual agency, we're still defaulting to those hand washing, shoe tying, personal care, household chore, those type of goals and learning opportunities versus the goals that are really meaningful to the person. When we looked over into indicator F, which talks about monitoring the effectiveness of each person's person-centered plan, the trend that we noticed there was that plans were not consistently monitoring. 5 out of 5 agencies had no direct observation by the QDDP. The Q's, caseworkers, whatever they're called in the agency, supervisors, whoever's acting in that Q role, is supposed to have direct observations of the people's goals, the people's plans being carried out. And the people we support, they're only reporting on what's being put on paper, but they're not directly going out and seeing these things being carried out in the person's home, in their day program, in their community. 4 out of 5, of the agencies that were reviewed, progress was not being measured consistently or effectively. And then 2 out of 5 of the agencies' quarterly reports didn't reflect data regarding targeted behaviors, and 2 out of 5 of the agencies' progress notes were not even completed. So we look at people are participating in learning programs, but they're not being measured consistently, meaning you don't know how well the person is doing if the person's not making any progress, or if they've reached a threshold and not getting any better, not getting any worse, they're just maintaining. And if that's happening, are changes being made or modifications being put in place to assist the person with improving in that area? The agency's quarterly reports or monthly reports, or however they're being completed, they didn't reflect data regarding targeted behaviors. If a person is taking medication to eliminate a certain undesired behavior, that has to be reported on quarterly, not just for the agency aspect, but also for the physician to make changes to medications as needed. And then progress notes weren't even completed for 2 out of 5 agencies, meaning nobody was monitoring for a certain time period. Nobody knew what was going on. Nobody was going in and seeing if people's learning opportunity programs were even successful. And when we looked at Factor 8, Indicator G, which focuses on positive behavioral supports, the trend, we noticed that BSPs are not in compliance with DMH Behavioral Services guidelines. 3 out of 5 agencies' plans were not reviewed by HRC or BPRC. 3 out of 5 did not have an active HRC or BPRC. 5 out of 5 did not have behavioral or psychiatric data or graphs available for review by the psychiatrist. 2 out of 5 of the agencies' information from the BSP was not referenced in the support plan, or their BSP and LSP, meaning their support plan, had conflicting information. 4 out of 5 were unable to recognize rights restriction or restrictive methods. One thing that this says is that agencies don't really know what's required to have a behavior support plan. So one thing to do is to know the department's DMH Behavior Services guideline. If agencies don't know what the guidelines are, don't know what's required, then there's no way possible they can be in compliance with this particular objective. So that's what we found out, the trend we found in this particular factor and indicator. And support plans and BSPs have to have the same information. The BSP doesn't have to be rewritten in the support plan, but it has to be referenced, and the information from the BSP has to be the same as what's outlined in the support plan in order for those two documents to cohesively work together. Also, being unable to recognize rights restrictions or restrictive methods. Agencies have to know what rights restrictions or what practices that they have in place that could be a potential rights restriction for a person. So after we reviewed the data and looked at it in more detail, seeing the trends amongst the agencies, we discovered several things that had an effect on the overall scores in this area. So now we're going to talk about what we learned. Factor 8, Indicator D, which is, just to remind you, individual plans lead to person-centered and person-directed services. One thing we discovered as we were looking at this is that most agencies took a deficit versus desires approach, meaning that the learning opportunities, they were deficit-driven. The person's desires weren't included. The services were put before the dreams. A person's dreams, if a person's dream don't fit into our services, then that dream gets pushed back. Agencies are doing assessments versus discovery, asking questions, but not using that information to carry over and develop a service that is specific to the person's dream. Agencies are doing association versus relationships, meaning we are associating people. We take them to the mall, we take them to the store, we take them to church, we take them to the park, but we're not helping the person understand how to build relationships. We're not interceding on the person's behalf and saying, you know, this person might be a good match for a friendship, or even recognizing emerging relationships where a person tends to always come and speak to a person served, or always have a little gift for them whenever they see them, and seeing that that's a way of building a relationship with a person. We're taking association as relationships. And looking at family contact versus natural support. Just because a person calls once a month to say hello, that may not be a natural support. A natural support is a long-standing, meaningful relationship. So family contact versus natural support. Just because I call doesn't mean I'm really a natural support. A natural support is somebody that is meaningful, a strong advocate for the person, a person that person can confide in, a person that person relies on for anything when they're going through a hard time, when they're happy. All of those things, a natural support would be that relationship in their life. As we go on into Factor 8 and looking at Indicator F, we looked at the data is just overall not being collected consistently, and it's not being consistently, and it's not being reported on consistently. Learning opportunity programs have to be monitored monthly and reported on quarterly. It has to be monitored either monthly or quarterly and reported on quarterly. QDDPs are not completing their face-to-face monitoring of learning opportunities. That's in the standard that's required. QDDPs have to go out and watch these learning opportunities being implemented in the home, in the programs. Plans and quarterly reports are not always accessible. Well, a person's plan, which is sort of the blueprint that we use for the person, has to be accessible in the home, has to be accessible to the person just in case they want to see it and read it. Quarterly notes have to be accessible and reported on, because how do we know how well we're doing or how well we're not doing if we don't have a way to measure that? It also said that no evidence that progress was being monitored for effectiveness. That kind of piggybacks on what I just said. Vague statements on the quarterly reports of progress. Some reports would say something like the person made some progress, made good progress, made a little progress. It has to be measurable. I need to know that I got it 6 out of 10 times this time, whereas last month I may have gotten it 2 out of 10 times. So your progress has to be measured to show progression. Some progress, good progress, little progress, that's left up to the interpretation of the person. And we don't want to leave that open to other people to make an assessment. We want to report on what the data actually shows us. Reports not addressing targeted behaviors. Targeted behaviors should be reported on, monitored. If a person has a history of slapping people twice a week and they take medication for aggression and they haven't had an incident of that in 10 years, but we haven't monitored that, the person could be taking medication they no longer need. So it has to be reported on in the quarterly report. And progress is not measured according to the baseline data. If a person's baseline data, they baseline on a learning opportunity at 50%, but their progress is measured at 25%, that's less than their baseline. The baseline is 50%. That means the progress needs to be measured higher than 50%. When we talk about what we learned on G, which focuses on positive behavioral supports, we learned that BSPs are not in compliance with DMH, Behavior Services Guidelines. Agencies have restrictive practices. Individuals are not included in due process. You got to know DMH, Behavior Services Guidelines. They're on the department's website. You have to know what is required. Agencies have restrictive practices. What are our policies? What are we doing that further restricts people in their lives? Individuals are not included in due process. People have to have some say in things that affect them. Necessary restrictions are never ending. Agencies do not recognize less obvious rights restrictions, and agencies do not have an active human rights or behavior review committee. People have to be, if a restriction has to be in place for that person or other people's safety, then the person needs to be included in due process, meaning that person needs to know that this restriction is put in place because of this reason, and in order to remove that, these things have to occur. And the person has to have some say about that restriction, how that restriction makes them feel, whether or not the time frame they feel is a fair time frame. People should be given the opportunity to attend their Human Rights Committee, to present their own plan, to be a part of the Behavior Review Committee, to talk about, whether or not they agree with the things the restrictions that are put in place, and whether or not they understand fully what those restrictions are. Necessary restrictions, we understand that some things have to be restricted. Some things have to be put in place for a person's safety or others around them. But every restriction has to have an expiration date. It can't go on and on and on and on and on forever. And as an agency, you have to be able to recognize the less obvious restrictions, such as bedtimes, meal times, lights out time, things like that. TV time, watch TV from 7 to 9, or you can't get your spending money if you don't have, if you exhibit your targeted behaviors. Those are less obvious restrictions. Now, if the restriction is in the behavior support plan and has been approved by the Human Rights Committee, then that's fine, but certain practices should not be just done without an approval. And agencies have to have or be a part of an active Human Rights Committee and Behavior Review Committee. So when we look at what we learned, how we got our information, then how we looked further into our information and got some more details into some things that wasn't going so well, we look at moving forward, looking ahead. How do we take what we learned and use it for quality improvement? When we look at Indicator D, the way to improve Factor A Indicator D, turn your assessments into information. Look at your assessments and say, you know what, based on this assessment, I learned that Kim loves to sew, but she's never taken a sewing class, or she does not know how to thread a needle. Well, the first thing you want to be able to do is thread a needle if a person wants to sew. So taking that assessment, finding out what my interests are, and then using that as information to individualize my services to what it is that's important to me. Prioritizing a person's dreams. We understand that certain services are standard with what it is we do day to day, but not putting the services I provide before the dreams that the person wants. So starting with what that person's dream is, what's important to them. Also looking at starting with what a person can do. We got years and years and years of information that tells us what a person's limitations are. We have all kinds of assessments, functional assessments, ICAPs, and other documents that tell you what a person can't do, what's not right. But if we look at it from an alternative perspective, what can that person do? If you start there and work forward, then you'll know what that person's potential is to accomplish their goals. Placing limitations last. Okay, I have a certain barrier that causes me to be unable to do something today. That doesn't mean I can't do it a year from today. So don't put the barrier, a person's limitations, before their dreams. And focus on inclusion. How can I give this person back their voice? How can I help a person learn how to make friends, learn the appropriate ways to introduce themselves to another person? Looking at less segregated events. Don't only go to the bowling alley on the day that bowling is designated for people with disabilities, not going just to dances that are designated for people with disabilities, not only attending church services that are designed for people with disabilities, but going to the regular morning worship, going to the bowling alley on a Monday evening on singles night or something like that is a great way to start to include people in what's going on. Attending yard sales in the community can help a person become included. Ways to improve in the area of F, what consistent practices are in place to ensure quality services. The standards require that the following areas be addressed either through quarterly or monthly status reports. So, according to the standards, you have to monitor and document progress at least quarterly. You have to monitor and modify learning opportunities when needed. That could be monthly, that could be quarterly, that could be weekly. Those face-to-face monitorings of the learning opportunities will help in those areas. QDDP should directly observe learning opportunities being completed. That way you know if you need to re-in-service the person who's implementing the learning opportunity, or if you need to change the learning opportunity because there's one area that the person served is struggling with. Have clearly defined processes for measuring and monitoring targeted symptoms. There needs to be a way that's reported on a daily or a weekly basis, preferably a daily basis, because we change from day to day. Also knowing what preceding things occurred that caused the person to maybe have that particular behavior at that time. Progress should be detailed and show progression or lack thereof. So progress needs to be detailed, meaning there needs to be some clearly defined, measurable way via percentages, via X out of Y trials, something like that has to be in place. And you start with your baseline and you build from there. All learning opportunities and targeted symptoms must be reported on. They have to be reported on. No way around it. With indicator G, let's think about the things we do daily without a thought. Are these the same actions that we practice that are practiced daily by the people we support? People with necessary rights restrictions have to have a realistic process to eliminate restrictions. No restrictions can be indefinite. So necessary restrictions have to be time sensitive. I said it earlier, I'll say it again here. No ADMH behavior services guidelines. Got to know it in order to be in compliance. BSPs, they have to have fading plans. There has to be a process to eliminate this restriction. The person may always need a behavior support plan or a way to monitor their behaviors, but there has to be a way to fade those restrictions. People must be given the opportunity to experience due process. Options, alternatives, preventatives, they must be made aware of those things. All plans have to be reviewed and approved by a Human Rights Committee. Agencies have to have a Human Rights Committee. All plans must be reviewed by the Behavior Review Committee. Agencies have to have an active Behavior Review Committee. Your Behavior Review Committee should review your plan prior to the Human Rights Committee. So you have to have an active Human Rights Committee and an active Behavior Review Committee. Agencies can in no way have restrictive processes. It can't happen. Practices cannot be restrictive unless they're approved by the Human Rights Committee. How are the behavior services being monitored? How is the progress being monitored? How are psychiatric or behavioral symptoms being monitored? So agencies, they can't have restrictive practices unless they're approved by the Human Rights Committee, and if that's been approved, then they have to be monitored. And we have to monitor for the less obvious things, the house rules, the bedtimes, the meal times, TV times, those type of things that are restrictive practices that we may not know about, or keeping people's money locked in a cabinet where they don't have access to it. If a person's money has to be locked up because a housemate tends to take things that don't belong to them, that person needs to have the key to the lockbox or have access to the key at all times and get their money as they want it. Also, things that are rights restriction, legal guardian, that's a rights restriction. Representative payees, those are rights restrictions. And those things have to be monitored. They have to be presented to the Human Rights Committee because a person may not need a full guardian. They may need someone to help them make decisions about their health care, or help them make decisions about housing, or help them make decisions about, make decisions about maybe relationships, people they want to have in their lives that aren't necessarily positive influences on their life. So they may need assistance with that, but maybe not full guardianship. So those things have to be presented and should be presented to the Human Rights Committee because it is a rights restriction. How do we know we have it? Ways to determine if we're on the right track. They'll show up in the lives of the people we support, in the lives of the people you support. Here are just some ways that we can know that we're on the right track. People's dream will become their reality. Person's desires will drive their services. Each person's plans and services reflect their individual desires and needs. We don't have a blanket way of providing services. We don't do what works for everybody. We don't puree everybody's food because one person has to have pureed food. Each person's plan and services have to reflect their individual desires and needs. Information becomes motivation. We take the information we learn and use it as motivation to provide services to the people that we support. We ask and then we act, meaning we're asking people what it is they want. We're asking them what they need, what relationships look like for them, what their services look like to them, and then we actively try to make the necessary modifications to make those changes in the person's life. We'll also see it. We can determine if we're on the right track by seeing that people lead fulfilling lives, they're building meaningful relationships, and they have an array of experiences. And people will build social capital, meaning they'll be invested in people, and people will be invested in them, and they'll have real friendships, real relationships, and they'll become a real meaningful part of their community. And we'll know we're there when the barriers do not supersede the goals. When the barriers become the furthest thing from our mind and the goals are at the forefront of our thoughts. Why is this outcome important? Personal outcomes and basic assurances. We look at Factor 10, which went into effect October 1st of this year. If we just look at if we look at factors 8, D, F, and G, and we want to know why that's important, well, if we look at 8D, which I'll remind you again, 8D focuses on Factor 8D focuses on positive services and supports, and it talks about individual plans leading to person-centered and person-directed services. When we look at the basic assurances, Factor 8D focuses directly on or includes people are connected to their natural supports. People have intimate relationships. People choose personal goals. People realize personal goals. People have friends. And you just look at your overall quality plan, which is our Factor 10, is included if we just look at these three things. If we look at Factor 8, Indicator F, which focuses on monitoring the effectiveness of each person's person-centered plan, we'll discover whether or not people are choosing services, whether or not people are respected, whether or not people are being treated fairly, whether or not people are exercising their rights. And it ties right into, again, your quality plan, your Factor 10. And when we look at Factor 8G, which focuses on organization, provide positive behavior supports to people, we'll find out if people are being respected, if people are treated fairly, again, if people are exercising their rights. And again, ties right into your quality plan, your Factor 10. When I went through and looked at all the things that the areas where we didn't score so well, I also took a little time and contacted the agencies that did achieve effective results. The agencies that scored well in these areas, they were randomly selected, just like the agencies that didn't get effective results. And an interview was held with them to determine what best practices they used to meet the requirements in Factor 8, D, F, and G. 5 agencies, all randomly selected, were interviewed and indicated the following approaches they take to ensure quality services. Some of the agencies said they had monthly staff meetings to discuss their services. So they met with they had a team meet. It included a supervisor, the Q, the executive director or program manager. It included direct care staff that worked directly with the people they served to determine what was working and what wasn't. They also had team meetings 30 to 60 days prior to the support plan meeting, the meeting with the person served, to determine what is it that you want to see for your life in the upcoming year. How do you want your services to change, or how do you want them to stay the same in the upcoming year? This was this was a meeting held only with the person served. And if a person does not communicate with words, then you would meet with that person and the person that knows them best. Then a team meeting is held with the family members or guardian 2 to 4 weeks prior to the support plan meeting. But that's a separate meeting from the meeting held with the person served, because the guardian does have say, but what's most important is the person served, their desires. So 2 to 4 weeks prior to the support plan meeting, the agencies are meeting with the family members or guardians just to find out, what is it that you've seen working for the person over the past year? What have you seen that wasn't working? What do you want to stay the same? What do you think should change? Then the support plan meeting was being used as a strategic planning meeting based on those previous 2 meetings held with the person served and the family, which the strategic planning meeting is led by the person served, meaning that the team that met with the person served talked to them about what they wanted, took that and said, and compared it to what the parent, the family member, or the guardian said, and said, okay, now that we're here all together in one room, we're going to come up with a strategic plan to improve services for the person served. These agencies also have internal quality review committees developed to monitor services and records, meaning that they have 2 or 3 people that specifically do an internal monitoring of their files, maybe 2 or 3 files a month. They monitor until they've gone through every file for each person served for their agency in order to either maintain their quality or see areas they need to make improvements on. And also, they use the personal outcome measures assessment tool. It works. If you use it, it will work. You will find out things that you never thought the person could tell you, or things that you thought was solid with the person. You'll find out, you know what, it really wasn't what I thought it was. And I took a minute and looked at CQL's national database, because CQL is sort of the the backing behind all of this data that we take, and also the backing behind the direction that we're going as a state and with the department. And we just looked at how they measured up, how we measured compared to how they measured. According to the data on the national database, 78% of the agencies they reviewed were connected to their natural supports. I'm sorry, let me correct that. 61% of the outcomes were there, 78% of the supports were there. People under intimate relationships, 70% of the outcomes were there, 69% of the supports. With regards to safety, 86% of the outcomes and 82% of the supports were there. With best possible health, 74% had the outcomes, 75% was there with supports. With exercising rights, we always struggle with this one. 49% of people served had the outcome, 47% of the supports were there. When treated fairly, 55% of people said they felt they were treated fairly. 56% of agencies had the supports in place. Freedom from abuse and neglect, 84% of people were free from abuse and neglect. 89% of the agencies were providing the supports for people to continue to feel that way. When it comes to continuity and security, 78% of people said they felt like they had continuity and security. 78% of the agencies had those supports in place. When deciding to share personal information, 78% of people said the outcome was there for them. 70% of agencies had the necessary supports in place. Choosing where and with whom they live, 46% of people said they chose where they live, and 56% of people were supported to make that decision. People choosing where they work, 40% of people say they chose where they work. Only 51% of agencies were providing support for people to make that decision. Living in integrated environments, only 37% of overall people said they lived in an integrated environment, and only 44% of people were supported to live in an integrated environment. And interacting with members of the community, 72% of people had interactions with members of the community, and 76% of people were being supported to do so. Performing social roles, 32% of people had social roles, felt that they had a social role, and only 33% of agencies were supporting people to have social roles. And choosing services, 50% of people chose their services. 39% of agencies were supporting people to choose their services. With choosing goals, 51% of people said they chose their personal goals, and 39% of the agencies supported people with choosing their goals. Realizing personal goals, 82% of people had done something that was meaningful to them, something that was important to them, that they realized that was important to them, and 82% of the agencies were supporting people to realize their goals. Participating in the life of the community, 70% of people had their outcomes. 70% of people said they were active participants in their community, and 79% of the agencies were supporting people to have to participate in their community. People have friends. 56% of the people said that the outcome was there for them, and 60% of the agencies were supporting people to reach this outcome. And when people are respected, 78% of people say they felt respected. 83% of the agencies that were reviewed were supporting people and helping people to feel respected. And this was out of 6,000 interviews held on their national database. As I get ready to close out my presentation, I want to give you a little bit of inspiration. I will end with these quotes. Don't tell me the sky's the limit when I know there are footprints on the moon. The author is unknown. Change is inevitable. Progress is optional. Author is Tony Robbins. So with that being said, we don't want to limit people. We want people to soar as high as they can possibly go. And ask yourself as, a service provider, as I've asked myself before, am I a person that is progressing, or am I a person that feels like I'm a victim of change? If change is inevitable, I can't control that, but I can control how much progress I make. So I had to ask myself, am I a person who's progressing, or am I a person who's a victim of change? So here are some resources that you can access. If you go to the department's website, which is www.mh.alabama.gov, you can find the assessment tool for basic assurances. You can also use the personal path and profile, which is a great format to use to help you kind of meet some of these areas if that's a concern of your agency. You can also use the Personal Outcome Measures Assessment Tool, which is on our website. Also, the areas that we talked about with Factor 8, D, F, and G, they're also referenced in our administrative codes, which you'll find here listed. Also, the link you can click on, or the website you can go to find these codes. And the Behavior Services Guidelines and the DD Administrative Code, which is 580-5-33, talks about the behavior support plan and what the requirements are and what the guidelines are. And thank you so much for your time, and I hope this information has been helpful. Have a great afternoon.